view from the chair. Welcome back to A View from the Chair. I am your host, Patrice Jordan Robinson, Chair of the Memphis City Council, as well as your representative for District 3. Your Memphis City Council is working hard each and every day, hand in hand with our mayor's office and his staff to ensure that all citizens remain safe, that you're healthy, and that your security is our top priority. Today, I am so excited about my guest. I want you to know that we want to keep you informed. Safer at home is still our best policy, and as a part of those efforts, we have invited Chief Communications Officer Ursula Madden and Dr. Manoj. Did I pronounce your name right?
Yes, Manoj, yes.
Manoj, thank you. Let me make sure I get that right. Jain,
yes.
He's MD, Infectious Disease Specialist, as our guest. A View from the Chair today to talk about our city's challenges and opportunities moving forward, pre and post Safer at Home. And we're talking about our policies, what's going on with COVID-19 pandemic, and how it affects our city and you as well. Welcome.
Well, thank you for having us. I'm delighted to be with you.
Thank you.
I'm so happy to be here today.
Thank you. As we promised, we're back with COO Ursula Madden with the City of Memphis and Dr. Manoj Jain. Welcome to A View from the Chair. So, Chief Madden, how are you? Okay, so how are you and the staff holding up?
We are
You took a deep breath.
I did, because honestly, I haven't had time to relax to really think about that. Mm-hmm. We have pretty much been working 7 days a week for probably the last 40 days or more, just to make sure that we are on top of the things that we need to be on top of as it relates to COVID-19. But as you know, in the city of Memphis, we don't get tired. So we don't get tired in the city of Memphis because we are continuing to give and provide services to Memphians to the best of our ability. And so we, in addition to making sure that people are safer at home and thriving during this pandemic, we are also responsible for making sure that their daily services are what they expect them to be. So making sure the trash gets picked up on time, making sure streets are paved, all the regular things that we would be doing in a normal business day at the city of Memphis. So plus. So it's the pace has been very, the drumbeat has been, we are in battle. And with that expectation, that means that we are available when our administration needs us to be available or when council needs us to be available.
And we appreciate your service. Councilwoman Robinson is getting tired.
No, ma'am, we don't get tired in the city of Memphis.
Okay. You all can tell that story if you want to. Dr. Jain, how is your day? How is your schedule? How is it fitting in to all the things that you have to do as a doctor every day?
So, Councilwoman Robinson, I'll say this. I love the energy that the team has. Ursula has described that energy that is within Mayor Strickland's team, as well as all of the city council members that I have interacted with, Dr. Warren, you, and others. And that energy really feeds many of us who are on the front lines as well. I see patients with COVID. I spend hours looking over the data each and every day. It's like a barometer and of how I'm going to feel for the next few hours. If I see the numbers going up, my wife can see it on my face.
No!
I know. but we have a lot at stake here. Many lives, many folks whose livelihood is dependent on us, that we do make the right decision, both balancing the health part of the changes that and the discussions that we're going to have, as well as the economic decisions that we have to make. And so balancing those two, including the spiritual and the societal needs, is so critically important that we have to balance. So we put all of that together to make the best decisions possible. And we really want to say to the citizens of Memphis and the residents here that it's a tremendous amount of sacrifice on their part as well.
Thank you. So how do you have children, Dr. Jain? What are they saying? What have they said to you about what's going on?
So yes, I have 3 children. One is in Boston with my parents, so with her grandparent, and the 2 are in college, and they're here. And I'll say this, at the beginning of all of this, they were ignoring the, not flagrantly, but they would sort of go out and about a little bit here and there. But now I think it has gotten to them that this is a serious matter. My in-laws, my wife's parents, are with us as well. And, they were questioning why they shouldn't go to the gym about a month and a half ago, before all of this was starting. And I was getting kind of uneasy about them being in the community. But I think they all understand the gravity of what we're going through and the real need for us to be social distance.
Okay. So, Dr. Jain, what exactly is this COVID-19? Talking to people, they just seem to think it's just any simple bug that we can get.
Oh, right. So I think it's best to compare it to the seasonal flu. So when you think about it, with a seasonal flu, a good number of us, 10-15%, will get sick, but we'll get better. Most will, without any question. The mortality rate, the people who die from the seasonal flu, are very small, maybe 1 in 1,000 or less. The COVID virus, the coronavirus, is very different. First, it kills a lot more people, maybe 1 or 2 in 100 who may become infected. The second, it's very infectious. With the seasonal flu, yes, some people may get infected if they were close to you, but we're finding with the COVID virus that there's a higher amount of infectivity. When you put both of those things together, that really is a terrible recipe in terms of causing havoc and the pandemic that we're seeing. I would not, let people sort of think to take it lightly. Yes, we will open up, but then we can take precautions, such as obviously washing hands 10 times a day, wearing a mask or a face covering. That's really important. Social distancing we talk about. And I'll tell you, if we maintain 6 feet away, we can prevent the virus. We as doctors are doing that in many ways. We wear a mask when we go to a patient's room, even amongst ourselves when one doctor and another doctor are talking. We wear masks, but also we maintain 6 feet. And that has prevented others, each one another, from passing the infection.
Councilwoman, I actually think people's habits, our social habits, are going to change dramatically once we get on the other side of this pandemic. I think the handshake may be a thing of the past. That's something
I can't get a big hug. Oh, no.
You can get a distance hug. I'll hug you virtually. But
all my little babies in the community that want me to love on them.
They do, and we want that. I think it's going to change a little bit. Dr. Jain said washing your hands 10 times a day. I am sure I wash my hands or dip them in some sort of, hand sanitizer more than maybe 20, 25 times a day. I have said the Lord's Prayer so much in the last 4 weeks just to make sure I'm washing my hands long enough. Hopefully God's hearing those prayers. So I think it's going to change the way we operate going forward once we're on the other side of this pandemic.
And I've taught my grandchildren to sing happy birthday and sing it 3 times while they're washing their hands. But we have a break in about 2 minutes. But I want to just share with you that I am so excited that you're here. This is so important that the community get to hear from professional people what's really going on. And this is not fake news. This is the real news. And my question for both of you is that the governor feels that it's a proper time to relax our statewide shelter-in-place order. But for cities like ours, where we're still doing testing and outreach so that we'll know exactly what's going on. I even had a mother of my church call me today and said, the governor said on May 1st, we can get back out there. So, Dr. Jain, what do
Sure. Yeah. So I think you raise a very important question, which is there's mixed messaging at times. The governor is saying something, the county and the city, however, are on the same page. And I think we need to look at why the messaging may be different. And the reason likely is that the data that the governor is seeing is somewhat different from the data that we're seeing. The governor is looking at counties across the state, which are often rural counties, and their numbers may not be as high as Shelby County or say Knox County or in Davidson County. And so what we need to do is to react and respond to the numbers that we are seeing here. Mm-hmm. And what we do know is that we have a high number of cases, and we will follow the trend of each day if the numbers are increasing or stabilizing. Once they begin to stabilize, then the conversation about opening begins. And in fact, over the past 8 to 10 days, we're already seeing some level of stabilization. So what we want to do is to follow that trend. And when that is stable, we will have that same conversation that the governor is having. And we've already laid out, Mayor Strickland has already laid out the plans of how we would reopen.
Okay. Right. So we laid out the back to business plan today. Mm-hmm. That was announced, and it's in conjunction, in concert with our Safer at Home. So we're still under Safer at Home. The trend that Dr. Jain is talking about, we have to see those numbers stabilize or go down over a 14-day period. So it's not, we've had 1 or 2 good days and now we're back in it. We're going to make sure that the trend is true and make sure that it's can be sustained over a 14-day period before we start allowing businesses to phase back in and operate. Okay. I think the governor is looking at 89 counties. In those counties, the state Department of Health has control over their health departments in those 89 counties, but not here in Shelby County. So the governor has said he's going to allow us to have some autonomy about how we open up. We're going to take him at his word for that. And we're going to open with and follow the advice that we've always been following, which is the data and the doctors. They're going to drive our decisions.
Thank you, Ursula. I'll be right back with more from A View from the Chair.
We're getting funky, y'all.
33% of Americans have a college degree. 43% of Africans in this country have a college degree. These are African immigrants that are coming into this country. They didn't have the opportunity and access, but they came over here in this American dream and created within this framework.
It's Funky Politics on the Kazukian Network.
A View from the Chair. We're back with A View from the Chair with my guests, Dr. Jain and Chief Madden. So we were talking about, just before we were breaking, about the COVID-19, what our governor had to say about when we're going to open back up and what the mayor has to say. So, Ursula, will you share with us how is the mayor going through this process with his team?
It's not unlike how we handle any sort of crisis situation that comes up, except for the communication is more constant, more regular. I think that our mayor Jim Strickland has shouldered this burden with a lot of grace, a lot of dignity, a lot of prayer. And he has relied not only on the administrative team that he has selected, heavily relied on us, but he also counts on the city council to help us get through this as well. He's in general just a kind of happy person. And so even though the situation is very serious, he still tries to maintain a very hopeful and inspiring outlook on our situation, and look for the opportunities where we can work together with other leaders and to do the best things for Memphians.
Yeah, Chairwoman,
yes.
Sorry, I'll add to what Ursula said is I have a conversation with him nearly every day, and I can tell you that, even in this difficult time, we have so many moments that we just laugh out loud, both of us. The other day, we were just talking about the situations and scenarios and personalities in a nice way, and we laughed for at least, I would say, a good 30 seconds, and that's all, both on the two sides of the phone. And I have to say, I really, really appreciate the mayor and all of the administrative team doing all the efforts, but also engaging the medical community in the conversations.
That's awesome. When I check in with the mayor, I used to call in the evening when he's finally made it home. And the last time I talked to him, "Oh, you sound tired." He laughed and said, "Really?" I know. I know that this is tough. It is, and not just for the team. And I want to say that you all have done a phenomenal job. The citizens of Memphis recognize that the mayor has led a great group of individuals to lead our city at this time, and they are very pleased. But I want to personally say thank you to each one of you for the work that you're doing to save Memphians, whether we believe in ourselves or whether the coronavirus is real or not. We know that you're doing it out of the goodness of your hearts and for the people of our city. So, Dr. Jain, I understand that we have more capacity than persons showing up to take the test. Well, how do you think we should encourage people to take more tests and avail themselves for this free testing?
So, very good question. If you remember a month back, we just didn't have enough test kits or the capacity to do the testing. Now we have. What people have to realize is that if they get tested, it is going to benefit them, their family, their friends, and their work colleagues. If they are feeling any fever, cough, even vague symptoms of not doing well, then it's highly encouraged that they go get tested. Also, those who may be working in a healthcare field or maybe frontline workers, they're also able to go and get some testing. That's what we call targeted asymptomatic testing. What I would encourage citizens to do is to really look at this opportunity to get tested, and if positive, then you will be helping not just yourself, but the family and others around you. Why? Because you will not pass the infection on to them. Also, health providers, doctors, nurses, and others will be better able to take care of you. So I think everyone needs to sort of look at the opportunity the city the state and the government, federal government is now offering to them, which is testing, and sometimes it's even free, or the insurance will cover it in many cases.
So talk to us a little bit more about the asymptomatic testing.
Yes.
I'm getting a lot of
Sure.
Before Dr. Jain goes to asymptomatic testing, I just want to add, there has been a very aggressive, highly targeted marketing campaign to get to those groups where we are seeing a wider spread of COVID-19 as it pertains to zip codes. Mm-hmm. The one thing that we are having trouble combating is sort of a grassroots dispelling myths. A lot of people think if you take the test, you will get COVID from taking the test. Or they come out and they say, no, we're not going to go take a test because they're experimenting on us like they did with the down in Tuskegee. And they're going to, inject us with something and make us sick. So there is some working through that kind of myth, rumor, and really historical perspective about government and about doctors testing individuals, especially within the poor African American communities. And so we have been enlisting our pastors and enlisting, the unofficial mayors in certain neighborhoods, asking them to say, I took the test. Now it's safe for you to take the test, so that we can break all that up and work through some of that. But we have desperately and methodically reached out to people to let them know that testing is free, and the places that you can go to get testing, it's all on the COVID-19.memphistn.gov website.
Thank you, Ursula and Dr. Jain. I hate to say this, but all of the pictures that we see on the news and on TV, where we have tents set up and lines set up for testing, and somebody comes out with this long swab, and then they decide that now that's going to go up my nostril and go all the way to the back of my brains. Oh my God. Can you better describe that for citizens like me? That's why I am staying at home, because I don't want to be tested. I don't want I don't want to be around anybody that has it, because I don't want to go through that. I'm waiting for the one where you prick my finger. I can take that pain, but I don't know if I can take that long swab. And and that's this is real talk, and our citizens need to know.
Sure. So let me take a moment and describe to you different tests that are available. So there are two major types of tests. One is that swab test. That looks if you have a current infection. So if you had a fever, if you have a cough, that test will let us know that if you have a current infection. The other blood test tells us if you've had a past infection. That looks at antibodies. That's the antibody blood test. So each test is used for different things. But yes, we do need to use a swab test to help determine if there is a current infection. However, for you and for all those who are afraid of that long swab, now they're testing for a smaller swab that can just be used around the nostrils, and also a saliva test. We should know within a week or so how good both of those tests work. And yes, we then, if they do, which we think they may, that we'll be able to not have to do that long swab test in the back of the throat, and rather do the saliva test or just the nasal swab. But I'll say this, yes, it may be uncomfortable, but that is a lot less uncomfortable than not knowing if you are infected with COVID-19 and can infect others. So if there's a need that we do need to do that, it's very short, takes about 5-10 seconds, and we're able to get a very good sample to determine if there is a COVID infection or not.
So 5-10 seconds of pain. And then it's over.
Discomfort. No. It's discomfort. It's discomfort.
Pain. They always say discomfort.
You're right.
Discomfort.
You're right. It's a shame that you got to tell the communications chief that, but you're right. It is uncomfortable.
And when doctors say discomfort, we know to start gritting our teeth. So,
You're making us doctors look bad.
No, I'm not. They taught you that in medical school to say discomfort and not pain.
Discomfort.
Mm-hmm.
But
that's right.
We don't hear that. We hear something else.
I know.
It does make your eyes water, though.
Yes,
It does. Yes. It can make your eyes water.
So, Ursula, from a
Keeping it real.
Stop it. So, Ursula, from a communication standpoint, in your opinion, is the president's daily press conference bringing on more confusion into the assessment and the treatment of the process that we're going through as a country, and especially in him handling the treatment and his opinion about the different treatments for the COVID-19. Do you think these press conferences are really helping the citizens of the U.S. understand what's really going on?
Well, Councilwoman, I would never presume to understand or know exactly what is going on in President Trump's mind or to understand what his communication strategy is. Mm-hmm. What I will say is what we are doing here in Memphis and Shelby County is to communicate very clearly with our residents to make sure that they have facts and information about what this disease is and how it can affect them and how the spread can impact their lives and what we need to do to make sure that our hospitals are not overwhelmed with COVID patients. You don't want to get political about medical issues, but because there are politicians involved, everybody's got a different style and has a different framework. What I will say is listen to the people who are closest to you locally, what that information is, where you can get the help that you need, and to go to very reliable sources for the information that you are getting. I will vouch for the information that we are putting forth in the city of Memphis and saying that it is data-driven, it is factual, and it is based on our recommendations that we are receiving from highly trained medical experts. And we are telling people the facts as we know them so that they have the best information at their fingertips, at their hands, so that they can make the decisions that are best for their lives and so that we can protect as many people from this disease as we can.
Thank you. I think it's so important that we share factual information with our citizens, and I appreciate how the city and county have provided factual information and the whole team for our community. Dr. Jain.
Yes.
If what the director of our CDC, if he's actually correct, could we actually be facing a second wave of this virus once this season begins in the fall? How do you think we can do to prevent having a second occurrence? Are we out of the woods for the current occurrence? So talk to us about that, because I see people moving back into their normal activity. I don't think we're there yet. Can you share with us what it looks like for us by the end of the summer or next fall?
Sure. So the answer very clearly, are we out of the woods? And the answer is no. We are still in the thick of things. We have to work through a process where each part of the city, people do their part. So the doctors are working diligently in caring for patients in the hospitals. The administrators and other leaders are building the capacity for people to be taken care of. And the citizens have to do their part. And their part is to reduce the interactions What we need to do is to starve the virus. And the way we starve the virus is to minimize the social interactions. So when the safer at home is lifted, that doesn't mean that we just go and hug every person without a mask and without the protection. That we do it very carefully, a sense of conversation that we're having with people, we mask, and we make sure to maintain that social distance from one another. Now, will this come back in a second wave? We do not know. I've looked at the remarks from the CDC director, and yes, there will be difficulties in our days and months ahead. It has to do with the flu and COVID-19 being together at the same time. But we will handle that when the time comes. What we do need to do is our part right now, each one of us, the doctors, the leaders, and the citizens.
Thank you. So we're about to come to the end of our talk today, and I am so excited that we could talk freely and openly on today with the citizens of Memphis. But I want to know, Ursula, do you have any closing points that you'd like to make or share with our citizens before we leave today?
I just want to reiterate what Dr. Jain has said. This is not over. Even though we have a plan and a blueprint for us to get back to business, the safer at home orders are still in effect. You must take it seriously. Please continue to do social distancing. Please continue to wash your hands for that 20 seconds at a time and to use hand sanitizer in between. And to love your neighbor and the people around you by not being around them. That sounds kind of, not a good way to love people, but at this particular time, it is. And I would say just thank you so much to the citizens of Memphis who are doing their very best to help the mayor and the doctors and our first responders by staying safer at home and trying to adhere to the orders. We greatly appreciate it. It's a lot of work and we know it's inconvenient. We know it's a sacrifice, but we wouldn't be asking you, one, if we weren't doing it ourselves, and two, if it wasn't really, really important.
Thank you. Dr. Jain, do you have any closing remarks?
No, I agree 100% with Ursula, and I want to thank everyone and be safe. And let's do this all together. Yes, we are apart, but we are together.
Mm-hmm. Well, I want to thank my guests today, Ursula Madden and Dr. Jain. I really appreciate you being with us today. It is so important for citizens to see you and to be able to hear your voices, to know that they are safe in your hands. And we are even safer if we stay at home. Y'all join Councilwoman Robinson. Stay at home. Don't tell my door because I am not going to let you in. And my children tried to yesterday. They didn't get in this house. So I certainly want to thank you again. Your professionalism was just awesome on today. And it helps to ensure the citizens of Memphis as well as the council to know that we have some people who have a heart for the work, a love for the work, and a love for our city.
Our experience with Kadzukian has been amazing. They are creative, innovative, flexible, work really hard, and they find the answer to every problem we put in front of them, every challenge we offer. We couldn't have better partners than Kadzukian.
Safer at home is still the best way to ensure that the coronavirus does not continue to spread throughout our community and we can get back to business as usual. Thank you for joining me today. I am Patrice Jordan Robinson, your host and chairwoman of the Memphis City Council. Until next time. A view from the chair.
Recorded at Kadzukian Studios. Directed, produced, and distributed by Kadzukian.